So far I'm happy with my results. I need more treatments. One leg was much worse than the other, but it's definitely working, smoothing out the area, increasing the circulation, doing what it's supposed to do.
Fat and cellulite is a problem that plagues almost everybody. We all have problem spots that we can't get rid of. There's areas of your body that may not respond to diet and exercise. Most notably may be cellulite. Cellulite is a problem that affects women anywhere from their 18 to 20 years old up to 50, 60 years old. You might tend to grow cellulite. Cellulite is a type of fat that's ripply, most commonly found in the thighs or the legs. Cellulite is found mostly in women. Very few men get cellulite. It's a hormonal nature that causes cellulite in the first place. Unfortunately, fixing your hormones won't get rid of cellulite. When women get cellulite, almost nothing gets rid of it without mechanical means. Certainly, diet and exercise are appropriate to reduce the development of cellulite, but once you get it, people find that they just can't get rid of it.
I had excess cellulite on one leg much more than the other, and it got worse after my third child. So I found Dr. Moak. He works for Mount Clemens General, which is what I'm affiliated with, and I knew he was specialized in this treatment.
The ideal candidate for a procedure such as mesotherapy or liposuction is somebody who's at or near their ideal body weight, but they have a problem area of fat that they can't get rid of on their own. Mesotherapy is a process of injecting tiny amounts of medications just below the skin with a tiny needle. These medications are designed to displace fat from the fat cell, and they also disrupt the fat cell to resist fat return. Mesotherapy is different than liposuction. Instead of sucking the fat out, we're injecting medicines that breaks the fat up. When the fat's displaced out of the fat cell, your body breaks it down just through a normal calorie process.
The first part of the procedure is to decipher what exactly you want and to accomplish and what areas of your body you want worked on. That consultation can take up to half an hour. At that point, you will have photographs taken beforehand. When you come in for the actual procedure, the nurse will stand you up and you will discuss with the technician or the nurse exactly what areas you're working on. And at that point, there can occasionally be ballpoint pens used to line the areas for the original. Once you've done your first treatment, that isn't necessarily done again. The treatment itself is a series of injections done with very fine needles, small amounts of vitamins and minerals in the proprietary mix are used in the injection. It is a very rapid series. If it becomes too uncomfortable, we can slow it down. It's not a problem to take a break if that's necessary.
Side effects of mesotherapy, well, there's common ones: soreness, redness, bruising. Those are going to occur in just about everybody. The soreness usually lasts anywhere from 1 day to 3 days. Swelling usually 2 or 3 days, and redness can last up to a week. Bruising lasts however long it takes to get rid of a bruise. More uncommon side effects of mesotherapy. Some people can have more significant pain that lasts a week or so. We don't see that too often, but that can happen. Some people get little lumps underneath the skin, and this is just irritation to the fat cells. That'll usually go away in a few weeks. Nothing to be concerned about. Recent devices have been shown to be effective for cellulite and fat reduction. The first generations weren't that effective, but recently we've had significant strides and improvements in technology to help break up fat and cellulite. Most recently, we added a gentle suction device that adds radiofrequency and light-based heat that seems to aid in speeding up the recovery from cellulite. This has shortened the duration of mesotherapy from several months down to about 2 months. Most people can complete a complete series of mesotherapy and cellulite treatments in about 2 months and have the results that they're expecting.
I decided to come in and get a consultation, and I wanted to try it out. So I have had 12 Vela Smooth treatments on my outer thighs, which have significantly improved, tightened up the area, and done exactly what they said it would.
Recently, great strides have been made to improve the effectiveness and safety of liposuction. There's a procedure called Tumescent liposuction. Tumescent liposuction started with injecting a tumescent fluid, which is a dilute solution of lidocaine and epinephrine. The lidocaine is to numb your flesh up, numb up your fat, and the adrenaline is designed to cause vasoconstriction so you don't have bleeding. The tumescent solution is infused into the fat and let it set for about a half an hour to an hour. The reason to let it set is as the solution is sitting inside the fat cells, it pushes the fat cells apart and softens them up, and makes them more appropriate for suctioning. This has made a great improvement in the recovery of liposuction. By letting the tumescent solution sit there for a while and adding adrenaline to cause vasoconstriction and adding an anesthetic agent, this is a nearly painless procedure that can be done as an outpatient, and you can return to work immediately. There's not downtime as there was with traditional surgical liposuction.
I would definitely recommend the procedure, the VeloSmooth and the Meso for that matter, and to come here because they do specialize in this area and they know exactly what they're doing. Everybody's different, so you need the consultation and then the doctor can decide what is exactly right for you.